Hey there, welcome to History in Lowell. I'm your host, Maritza Grooms, and I'm here with one of my favorite humans in the world, Robert Forrant. So today, we talk about so much history and how it relates to current contextual conversations, current events, and of course, in the lens of Lowell. So we've been talking a lot about, I'd like to say the conversations have largely been about racism in law enforcement and criminal justice, or the lack of justice, right? But we don't really talk about how racism pervades in the entire system and what systemic racism really looks like. So we know that it's there in healthcare, education, housing. But one thing that I think is maybe coming more to the forefront, especially with COVID and just probably the state of the world, is environmental justice. So that all relates to what's going on right now with racism being declared a public health crisis. And of course, the letter that is circulating in Lowell right now to have people actually get on board with that. So Bob, where do we begin? There's so much to unpack here today.
Yeah, I mean, I think the recognition now, and again, it's sort of like why. I mean, if you think about it, it's obvious, but again, it needs to be articulated because sometimes people just have this white block. I don't know what you want to call it, something in their cortex that allows them not to see it, and that reduces people to puddles of thinking. Like if you say Black Lives Matter, then you're saying all others don't, right? And so if you say public health, that if you contextualize healthcare and you say, there's a racist element to it, then everybody that might work in healthcare that doesn't want to be reflective will all of a sudden, lash back or not listen or whatever. And the same way that people have for years understood that systemic racism impacts education. Well, why wouldn't you also think, by logical extension, that it would impact these other systems, right? As you said in the intro, housing and other things. And healthcare is so fundamental, and good or not good health is so tied to every other thing that can happen in one sort of life path and life trajectory to not see it. And so in Lowell, just to be really quickly specific as an example, historically, when newcomer groups came into the city, they were largely poor. And in the late 20th and in the early 21st century, they were largely populations of color. And they largely end up in what historically have been the oldest, poorest neighborhoods in the city, and that carries with it the freight of environmental injustices. And by that I mean overcrowding,
Mm-hmm.
lots of traffic, lots of noise, but also lots of buildings that are built with paint and insulation and all sorts of
Mm-hmm.
other things that now would not get put in a new building but are in an old building.
Right.
And so then you end up with these catastrophes. Every once in a while, you find out a building or two or three in Lowell or some other working class community in Massachusetts is riddled with lead paint. And everybody knows historically the impact of lead paint on brain development in young kids and
Right.
what that all means. And so that's the same way as racism is baked into education. It's baked into the health system, and I think we're using today the thinking about health in a broad base. We're not just thinking about what happens if you go to a hospital. We're thinking about life, sort of access to food, all sorts of
Mm-hmm.
things.
Right. And when we think about Lowell, we think about, we always, again, we pat ourselves on the back for all the things that we're doing well. But I do want to shout out places like Mill City Grows, because the founders there saw a need. They recognized that there were food deserts in Lowell, and they made sure to establish community gardens in these places like the Acre. And I think that's incredibly important when we're discussing something like this, because we know that that's all tied into that exact kind of thoughts, right? Because public health isn't just about the healthcare system. Public health is access to social programs, making sure that your environment is just safe for you to be in. How many kids can go outside and play? What do their parks look like? Are they riddled with needles and things like that? And so that's what I think of when I think of Lowell. All of those things all tie in to the broader picture.
Yeah, and the Mill City Grows is a good example. The Lowell Community Health Center is another one where that institution has filled a major gap by trying to figure out how do you deliver actual face-to-face and now telephonic, whatever, healthcare to a variety of different nationalities, ethnicities, different ways that people think about healthcare and about their body, and how are you sensitive as a healthcare provider to doing all those things. And it's really complex. And so so while you have something like a Mill City Grows, which you mentioned, or a Lowell Community Health Center, everybody else has to be, all the other institutions have to be on board the same way, so they mesh. So the city of Lowell, which has nurses in the schools, and the city of Lowell, which has a Department of Public Health, all these institutions also have to step up and understand this the same way. You can't have like a couple within this plethora of delivery systems that understand it or are trying to do well, and then the rest of them are either lagging behind or simply ignoring it. Because again, using your word from the intro, it's systemic. And the only way you can deal with it is you have to deal with it. And it's richly complex, which makes it interesting to talk about and try to figure out what to do. And it also makes it really frustrating to try to get your hands around it and try to do something, because it is so complex. But if you don't start, right? And so again, just thinking of a couple of other examples sort of in Lowell and in Lowell's history. There was a while back when the first efforts were being made to build this, to close the school over in the Acre neighborhood. There was this real rush to get the land and build the school building. And a lot of people that understood the history of that area where they were going to build a school off Broadway understood that that had been a landfill. And that nobody had really done due diligence in terms of an EPA site cleanup to understand what was there. And so people really pushed back on this rush to build a building, and thankfully they did, because it was a really extraordinarily polluted place within the city. And had they built the school on it, probably it wouldn't have ended well. They would have either had to tear it down or do an incredible amount of abatement at real expense. But initially, a lot of people in the city, were angry that people were raising these issues because it was going to delay the process, and by delaying it might cost a bit more money. But it's just another one of these sort of historic examples where, and people don't necessarily, again, think of that in the context of what we're talking about this morning, but it is, right? So you can't pat yourself on the back, which the city was doing. Oh, we're building a school in this neighborhood which hasn't had a new school for a really long time, but then not actually care about the health conditions at the site. Like, how do it doesn't compute. But again, it's because we, as a society, we tend to take these complicated problems and, like, I'm an expert in this, and so that's all I think about. And you're an expert in that, and we go in these narrow lanes. Yeah, exactly. And it's the frustration of academia, because I feel like that's what we do all the time too. But that's just one example amongst many you can think of in Lowell. I mean, that's really recent. That's in the early 2000s. I mean, that's in the late 90s, early 2000s.
Right. That's so wild to me, because I think about, like, I went to school in Boston. I was in school at that time. Can you imagine if that school had been built and I was living in Lowell? I don't think that my brain would function if I was going to school on top of a landfill. Like, how do we expect kids to be able to learn in these kinds of environments, and to know that your city did not even care about your health and well-being on a fundamental level, and
Right.
they're more worried about the cost?
Yeah, and again, some of it is not, like, not always is it like people are evilly intended, you know, they're not sitting and going, wow, let's build a school on a dump. But they're not thinking about it, right? They've also built housing in the city, and then that's come back to haunt them later in the same way, right? And sometimes it's, but again, it's because they don't, that we, and I shouldn't keep saying they, we don't think about these things, again, using your word, in the systemic way. So if you're going to build something new and fresh, what are you building it on? Like that seems pretty basic, right? But if you're not thinking that way, I mean, I do think, but again, now in the environment, in the environment that we're in, the current president has relaxed excessively the EPA requirements for doing these site rebatements and things like that for projects like this, right? And so I'm sure it will, you know, something's going to get rushed and get built, and 10 or 15 years later, hopefully I'm still around, but you will be. You know, we'll be reading, you'll go, oh, that's what, yeah, I remember when we talked about that, because it's like the water in Detroit.
Yep. Yep. Flint still doesn't have clean water.
Right. All this time, right?
How many years has it been? Over 5?
And again, initially it was, oh no, there's nothing wrong. They fired the people in public health in Flint that brought it, they fired the people in public health that brought it forward.
Right.
You know, shot the messenger rather than fix the problem. And they still haven't fixed the problem.
And it's my understanding that they also fined the citizens, the residents, as if they caused the water to be contaminated.
Yeah. Yeah. I mean, in Lowell, here's another, this goes back even further. But in the late 19th, early 20th century, and we sort of plowed over this immigration history, but every spring and summer, there were typhoid epidemics in Lowell. And mostly it was caused by bad drinking water. People were drinking out of the river, out of the canal, and people were also using the river and canal to take all kinds of waste away, including human. And the death rates were really fairly high in some summers, not so high in others, but largely confined to the areas around Lower Belvedere and the Acre, the poorer parts of the city. But in one particular summer, Upper Belvedere, the death rate spiked. And shortly thereafter, the city built a water treatment facility and became one of the first cities in the country to actually think about clean water. But you know, like people that have done the research show, like, you know, these spikes every so often in these largely working class, poor, new immigrant neighborhoods, and sort of like, oh, well, that's the price you pay, right? And then as soon as some rich people's kids, not that I want any kid, you know, I'm not like belittling that, no kid should die of drinking bad water. That's obvious, right? But what sparked the action in Lowell, you know, to build a pumping station and water filtration and build a reservoir up on the top of Christian Hill and my up above me in my neighborhood in Centerville, was a typhoid epidemic that began to affect people that were like second and third generation in the city, and were a little bit better off. But it's the same story.
It is, and we see it all the time, right? Take COVID, for example. It disproportionately impacts communities of color. We know this, but until maybe it's impacting those on the Hill, right? We probably won't see as much testing. We probably won't see any kind of treatment or until it starts impacting the economy again. We aren't going to actually see any action. I think in Texas right now, the officials are like, oh, we didn't mean for you to go outside. I mean, you know, like totally backtracking on reopening everything. And now the cases are on the rise again. And that's not anything to be taken lightly, of course. It's just what keeps happening. And I think that's an epidemic right there.
Yeah, and again, if you use like Texas, Arizona, places like North Dakota, Iowa, where there was meatpacking, largely when the push was on to open everything up, it essentially was to get immigrant workers, migrant workers, workers of color back in the meatpacking plants and out in the fields picking, you know, lettuce and grapes and tomatoes and whatever. And those are the folks that got sick. But what happens in the same way it took a long time in Lowell and in Massachusetts, with people really pushing to disaggregate the data and say, well, we know these many people in Massachusetts have it, but what do we know about race? What do we know about nationality? What do we know about income? Like, how do we, because you can't design policies to effectively try to treat something if you don't have better data. It took a long time in Lowell and elsewhere in the state to actually do that. And people fixated instead on, well, mostly people are dying who are over 70, and sort of that sufficed for like science or something. But now when you look, eventually the state, and this is how you can see back to the earlier thought about racism in healthcare and racism in health in general. If you look at the top 10 cities in Massachusetts with per 100,000 the numbers of cases, it's almost, I mean, there's a couple of exceptions in there which I don't understand, but the majority of the communities, are African American, Latinx, and or recent, immigrant refugee communities. And again, they're in environments that don't lend themselves to access to healthcare, good diet, exercise, all the kind of things we know are right, but that are expensive. And not expensive necessarily in dollars per se, but expensive in terms of like, where do you find the time?
Yeah, accessibility, all of that.
Yeah.
Yeah.
And so I think, the idea of this letter that was circulating in Lowell, I think was really to draw that attention. And it's interesting that it came about, I think, in the same week and a half or 2 weeks when other people were challenging the city to show its who's working, who's hired, and who's working in the city. And so it was this interesting, for me, again, thinking about all of these issues, it was this really interesting confluence where on the one side, you had people who care about public health looking at this and calling it what it is. And then on the other side, you had another bunch of people saying, and oh yeah, by the way, who works for Lowell and who gets hired in the schools and what's the workforce look like in police and fire and at City Hall. And, sort of it's rippling out to take a look at like boards and all sorts of other things in the city. And this then becomes really problematic for a lot of people who will champion what on a general level will say the right words, but saying the right words at this particular juncture doesn't, I mean, words are cheap.
Words are very hollow when actions are lacking, and where there are no specific follow-up items to say, okay, this is what we believe and this is how we're going to show you.
Right.
Policy goes hand in hand with practice. I just love your word confluence, because it's such a beautiful demonstration of everything that is happening and showing how everything really is so intricately connected. And we can't separate the parts from the whole when we're looking at racism and these kinds of issues.
Yeah, and if you think again, sort of thinking about the environmental part of it, there's plenty of documented research people have done that African Americans are more likely by vast percentages to live near toxic waste dumps and toxic facilities. Most spent uranium from nuclear power plants is buried and dumped either on or near Native American land. I mean, you can go on and on about these things, like Silicon Valley, and people think, oh, that's like clean manufacturing. Ooh, it's high tech. It's not. It's some of the most highly toxic, some of the most highly polluting. That's why so much of the manufacturing ended up getting out of California and being put in countries that have less stringent environmental regulations. But the solvents, the cleaners, all of these things are highly, highly toxic, and they leach into the groundwater. And they'll stay there from forever. And people will, I mean, there's a bunch of research that people have done in the last 10 or so years looking at the border between the US and Mexico, where large numbers of US manufacturing facilities went. They just jumped over the border into Juarez in Mexico. So they're like 10 miles away from stringent, and more stringent, I shouldn't say stringent, more stringent environmental regulation than in Mexico, still not stringent enough. And how much you know, the escalation of asthma, of birth defects are happening to, you know, Mexican women of childbearing age, and everybody acts all surprised.
Mm-hmm.
But again, it's like, geez, like, why are you acting surprised? You moved it there so that it wouldn't happen here. Like, why, you know?
You knew what you were doing. And some of those people, as much as they're not the ones that are sitting like this, some of them, maybe much like our current inhabitant of the White House, seem to be these
Mhm.
kinds of folks who are very much trying to protect themselves, trying to protect their positions of power and privilege, and also actively blocking resources to these communities who need it the most.
Right. And again, that's the, if you're going to do, I mean, that's the thing with Flint, right? If you were going to do that water abatement, it's an extraordinarily expensive proposition. So how do you get that done? If you, several years ago, a friend of mine wrote a book called The Toxic Schoolhouse, which
Mm.
sort of looked at all these school buildings and the way they got built when, you know, with asbestos and with certain kinds of paint and rugs that gave off gases and linoleums and all these things that, you know, and buildings with windows that don't open,
Mm.
bad air circulation, right? This is all the worry now with reopening old school buildings in September. It's the same sort of a thing. You don't have the building infrastructure in poor and working class cities, you know, where you can count on there being decent air and where you can count on there being airflow and you know, environments that you can that can be adapted, and can be made easily be made clean on a regular basis. And those communities also. This is what is troubling about this. I understand why they want kids to be back in school. On the one hand, get it, but on the other hand, if you're going to push kids back to school but cut all the school resources, we know which communities are going to be impacted.
Mm-hmm.
It's not going to be Newton and Brookline. And no offense to
Exactly.
people who might be watching who live in Newton and Brookline or the Tonier parts of Cambridge or whatever, right? I mean,
Mm-hmm.
it's just a reality. You know, whether you want to say, oh, whatever, I mean, that's just the reality. Sorry. We
Exactly.
know it's going to be Lawrence that's going to be impacted. It's going to be neighborhoods in Lowell. It's going to be Fall River, New Bedford, Worcester, Chelsea,
Mm-hmm.
Revere Land. I mean, I know, I can tell you already.
Yeah.
It's going to be particular neighborhoods in you know, Boston, Mattapan, you know, Roxbury, you know, whatever parts of Dorchester.
Yep.
Um, just know it, right? You know it
Yeah.
better than me, living now where you live, right? And then everybody's going to be shocked again in November.
Oh, yes. And this is what I've been saying for months. Like, the cognitive dissonance is so real. And we are walking, I feel like I'm being gaslit by the world. Like, I'm walking around with the mask on and I see everybody without a mask. And I'm just like, okay, no, I just don't want to be around any of you. I just need to get this milk or whatever I'm going to get, you know? But it all comes back down to when we say Black Lives Matter. Nobody's saying that everybody else doesn't matter. We're just saying all of these issues that we're talking about disproportionately affect Black folks and communities of color. And we've known that for a long time. And it's time that we start acknowledging that and acknowledging the disparities and inequities that have been kind of a part of the system and the way that it functions for a long time.
Yeah, and uh, you know, we started in the beginning talking about housing and how newcomers generally end up in these, you know, in neighborhoods historically that have been immigrant neighborhoods or that were at one point African American neighborhoods, and they've transitioned to be maybe neighborhoods with refugees living in them or a
Mm-hmm.
combination thereof, right? And that's not by accident. I mean, there's a history of housing segregation, of a term that people use called redlining, where if you were, even if you were an African American professional and you had a really great job and you went in Boston to a realtor to buy a home somewhere in Boston or greater Boston, they would take you to only certain places because other places were redlined. There was a map, you know, there was a, not like sometimes literally, but figuratively, there was yep, that's not where you bring African Americans when they're looking to buy a house. And consistently, when you do that over time, you break the cycle or the possibility of the way so many white middle-class people made their sort of jump generationally, from working class to middle class. And I hate the way people now, like, don't talk about everybody's middle class. That's just not true.
No.
But like my dad could buy a house from federal legislation, which meant that I grew up in a house that he owned, which gave him the potentiality to provide for me in a different way than if we lived in a block somewhere. That's just the reality, right? And then that generational wealth, not, when my dad and mom passed away, that house was an asset they owned that my brothers and sisters and I sold, and because there's 5 of us, we split the proceeds and we each had a chunk of money. And that's like building wealth. And if you can't do that, you can't build wealth. And if you can't see historically that that's my privilege, then there's a point where I don't want to, I'm not to put words in your mouth, but you talk about gaslighting. There's a point where we can't talk anymore. If that story I just told you doesn't make sense to you, then what are we doing?
Exactly. Yes. Bob, you said it best. If it doesn't make sense, then what are we doing? It's time to face reality, folks. And unfortunately, we are out of time.
Reality of the clock.
Yes. So
that didn't seem like 30 minutes. I don't know.
I know. It didn't seem like it to me either. But as always, Bob, thank you so much for bringing us with the facts, because we have to face them. As James Baldwin said, nothing can be changed unless it is faced. We may not be able to change everything that is faced, but nothing can be changed until it is faced. So
yeah, and somebody said maybe Malcolm X, or it might have been James Baldwin, nothing comes to a sleeper but a dream. I'm not sure who to attribute that to properly, but that's one I like as well.
Yes. Thank you so much, Bob. Thank you all for tuning in. This has been History in Lowell, and I'm rooting for everybody Black.
Take care, everybody. Be well. Wear your mask.